Good evening, everyone. So today we will be talking about a topic called as child psychopathology. Under that, there is something called as abnormality, abnormal psychology. So we will look into that. Child psychopathology is the unit. So here under this unit, we will be understanding about what is the meaning of child psychopathology. You would have heard about the term pathology, but then what is this child psychopathology, and then what could be the reasons for children to get disorders, and then what kind of treatment can be given to them, right? So first of all, coming to the definition of what child psychopathology is, here before that, what is pathology? Pathology is the study of the nature of diseases. So whenever we understand about any kind of disease, for that matter cancer or any kind of disease for that matter, we will first of all understand the causes of the disease. Why do we understand the cause of any disease? Because so that we can prevent it later, we can prevent further spreading of the disease, mainly if we can understand why is it happening, right? And then how does it develop? So once you get the disease, when someone get the disease, how is it developing inside the body, how we can control them, right? So we can understand that, and what is the outcome of the disease. Some patients may recover from the disease, some people may die, correct, some people may partially recover. So pathology is the study of nature of disease, various kinds of physical disease. However, when we talk about the child psychopathology, here it refers to the scientific study of mental disorders in children and adolescents. When I talk about children and adolescents, the age group will be from infancy till the age 18, right? So teenage years, all of them are called as adolescents. Even before 18, like first PUC, second PUC, till there they are called as adolescents. Probably till 16 years of age we call them as adolescents. So child psychopathology means it's a scientific study. Now what do I mean by scientific study? We cannot randomly tell that this child has mental retardation, or this child has autism, or this child has attention problem, right? So you would have heard about many pathology with which the child is going through, right? So we cannot simply say that through a lame observation that okay, this particular child has this disorder because he or she is behaving in this way, until and unless you are a trained professional, right? So even when the trained professional comes into picture, they will have to administer certain kind of tests. So therefore it is called a scientific study, right? And what are the different kinds of disorders, that is the mental disorders that the children can go through? Earlier it was thought that okay, it is only the adults who can have depression or varieties of disorders, that is the mental disorders. But now recently, from past few years, doctors have come up with various disorders wherein the children are also experiencing them, right? So here, for example, autism is one childhood disorder. Then mental retardation, from the day the child is born, will get to know how he or she is behaving and all of that. And oppositional defiant disorder, attention deficit problems, and some children are too hyperactive, they cannot sit in one place for a longer period of time, they cannot concentrate on one task at a time, right? So autism spectrum disorder, wherein the child cannot communicate properly with their parents, they do not care who their parents are, right? And they cannot talk properly, they do not want to involve with the society, right? So these are the varieties of childhood disorders which is prominently seen in children and adolescents also. Adolescents, when we talk about adolescents, oppositional defiant disorder is very common, depression is very common, right? So we'll look into it in detail. Coming to the history of child psychopathology, this child psychopathology or the child psychiatry is blooming now, right? It has very much scope nowadays, right? So child psychology, earlier very little attention was given to childhood disorders because people didn't know that even the child can get mental problem. It was only thought that okay, it is only the adults who get mental problem, but now they have understood that from the day the child is born, it can be susceptible to various forms of mental disorders, right? It's only recently that the child psychiatry and clinical child psychology have been paid more attention to. So psychiatry means where medicines are prescribed, right? And psychology means probably where the psychologist will just do some relaxation therapies, or they will give some therapies where medicines are not involved. Counseling would be done if the child has exam anxiety, or probably the child would have been bullied in their school or in the college, and therefore they don't want to go to school at all, right? So at that time medicines will not work. It's only the counseling and little bit of talking therapy that helps. Whereas when the child is being diagnosed with depression or any other serious mental disorders, where only talking or the relaxation technique or any other technique will not work, then the parents will have to consult the psychiatrist. Sometimes when the child is very aggressive and it cannot be managed with the normal therapy as such, at that time also children will go to psychiatrist. And theories of adult psychopathology were unsuccessfully adapted to childhood problems, correct? So it is sure that there is a lot of difference between the symptoms that an adult shows and the symptoms that a child shows. In whenever they have a disorder, the way their child expresses its symptoms is completely different from the way an adult expresses his or her symptoms for the same disorder, right? Say take depression for that matter, the way the child expresses the symptoms would be little different, although I cannot say that it's completely different, but then some differences will surely be there compared to the adults, right? So hence nowadays the scope for childhood pathology is increasing, because the whatever theories that people came up with, psychologists came up with for adult psychopathology, be it Freud, be it Skinner, or whoever it is, same thing with the modifications we need to apply it to children. Same thing, whatever you do with the adults, you cannot do it with the children, right? So therefore it is the flourishing branch of psychology. And here what scope do we have under child psychopathology is, first of all, it is at the research level, right? Because the knowledge that we have about child psychopathology is very less or very limited. We may explore what causes it, and we may explore how we can treat it or how we can prevent the disorder, right? So therefore research is very important. And when it comes to treatment, say now the child already has a disorder, so how do we manage it, right? So there are varieties of treatments available. Take it mental retardation itself, no one treatment will be applicable for all the children with mental retardation, right? So there has to be several various forms of treatments. So therefore these two are the areas where we can look into. So research, psychologists, psychiatrists, neuroscientist. Neuroscientist is the one who understands about the brain and the behavior. How is the brain functioning in a child who has autism, or how is the brain functioning with a child who has mental retardation or attention problem? Why is the child having attention problem, right? So all these things will be explored with the help of neuroscientists, and others are also trying to make sense of the different manifestations. Manifestations means changes of mental disorders which are seen in clinical practice. Now when the child, say for example, child A has depression, child B also has depression, okay, but then the way a child A behaves is completely different from the way a child B is behaving, right? So at that time it is a question, it's a matter of question, right? So even though both of them are having the same disorder, the expression of symptoms would be different. why is that so? Why is that manifestation happening in the mental disorder? So we need to research on that. What could be happening in the brain, right? So all these things are very important to understand, and therefore research is a one scope of development under child psychopathology. And coming to the treatment part, as I told you, there is no one particular treatment. Say for example, when we get fever, okay, when a person has fever, we take one tablet. Say, there are varieties of tablets like crocin or Dolo 650 is very prominent nowadays. We tend to take such tablets, and then we tend to recover from it most of the time, even though sometimes we make a mistake of not consulting the doctor, right? So there are varieties of treatment, but when it comes to psychological disorders, there is no one particular way of treating a disorder, right? So varieties of treatments should be given, and also you never know what kind of treatment can be applied for which kind of disorder. So professionals attempting to apply the diagnostic systems are in a place to provide effective treatments to individuals living with psychopathology. So trained individuals will be able to give proper treatment to the child, and there are varieties of treatments. It's not like only one. And these are the names of the people associated with the treatment part. That is clinical psychologist. Clinical psychologist is a person who has MPhil degree in psych. Counselors who would have completed master's degree in psychology. Criminologists are also psychologists, wherein they would have studied forensic and criminal psychology in their master's degree program. And these are all the specialization. Master's degree is compulsory, and later on there will be many more specializations. Marriage and family therapist, and then nurse practitioners, right? Marriage and family therapist under child pathology, because even how is the relationship between couple, how is the relationship in the family will also affect the child's development, right? If there is a conflict, if there is a marital conflict, say both the parents are not talking to each other, or there is a separation, or there is divorce, then obviously it will hamper the child's growth and development, and there will be a lot of stress in the child. Therefore, marriage and family therapists are also concerned with the child psychopathology. And nurse practitioners, psychiatric nurses, psychiatrists who has a MBBS degree, that MBBS and then MD or DNB is the profession. And social workers who have taken clinical psychology as a subjective paper specialization, and sociologists. All these are the people who are concerned with the treatment part of the child psychopathology, and some are even concerned with the research also. And now moving on, when we say psychopathology, some symptoms are noticeable. But even though the disorders are different, sometimes we may get to know that, okay, my child is showing some symptoms, and those symptoms can be common to varieties of disorders. So what are they? One is changes in the eating habits. The child may eat very less, or the child may eat very more than what is required. So it is moving away from the normalcy. So changes in eating habits, changes in the mood. Sometimes the child is very, very happy, very jovial and all that, but then sometimes he might be showing aggression, or sometimes fear and all of that. See, imagine that the child has undergone an abuse, okay, probably sexual abuse or physical abuse. The child earlier was very happy child, okay, he was very enthusiastic, he likes his friend, he likes to play and all of that. But now the child has undergone abuse, and after that abuse there would be a lot of changes in their mood, right? The child might become suddenly very silent, they don't want to go outside, they don't want to meet people, they are very much aggressive, and they are fearful, right? So changes in the mood is very much observable, and parents or the caregivers will have to notice all these signs of psychopathology. Excessive worry, anxiety, or fear. See, worry can be told to children who are of little higher grades. When it comes to first standard, second, third and all, the worry part might be little less. Fear will surely be there, anxiety will surely be there, and feelings of distress. see, stress, when we talk about, there are two different types of stress. One is eustress and another one is distress. So distress is when it will cause harm to the body because of there is some release in the hormone and all that, and inability to concentrate, irritability or anger. They do not want to talk to their parents, they are simply throwing the objects around, right? And you ask them something, they'll shout at you. Low energy or feelings of fatigue. See, because of the mental stress, the physically also they may become very weak, and because of changed in the eating habits also, they may become very weak. And sleep disruption, sometimes children, especially who are abused, may not sleep properly, or they may have nightmares. There will be a lot of disturbance in the sleep. And some children, because of depression or something or some other disorder, they may sleep excessively more than what is required. And thoughts of self-harm or suicide will also be there. Trouble coping with everyday life, they'll not enjoy their childhood. And withdrawal from activities and friends, one of the signs of depression. So these are the very common symptoms of psychopathology. But then there will be few specific symptoms also, depending upon which type of disorder the child is having. And now, how do we identify? Based on scientific, see, these are all the observations which people at home can make. Those who, see, not everybody studies psychology, not everybody is a psychiatrist, right? So but then parents or the caregivers will notice all these signs. These are observable and they are very much evident. But when you take them to a psychiatrist, there is scientifically identifying, and there are two different ways of how do you identify them. So one way is through a book called as Diagnostic and Statistical Manual of Mental Disorders. This has been given by American Psychiatric Association, which is APA, and it is an official manual. It describes and classifies various psychological disorders, right? So with the help of this book, we can clearly state what disorder a child is having and what is the level of that disorder. It is like a reference material for all the psychiatrists and the psychologists, right? And now the DSM is in 5th edition. It has 5 axes, and the dimensions are related to the biopsychosocial concept. So it says that whatever would be the cause of the disease, it will be related to the biological, psychological, and social aspects of the child. Now, moving on to the next manual, which we refer in India as well, is called as International Classification of Diseases, which is ICD-10. So here the classification scheme officially used in India and elsewhere, and it's also known as ICD-10. It is in its 10th edition, and it is the classification of behavioral mental diseases and not disorders, right? It is prepared by World Health Organization, and for every disorder, description of the main, how is the clinical feature of it, what are the actual symptoms of this particular disorder, and what are the guidelines, what we need to follow. All these things will be discussed in this particular disorder, right? And now moving on, so these two you need to remember which when we are using for the classification. So now in the next slide here, when do you call that a child is abnormal? What is the abnormal behavior? There are something called as 4 Ds of abnormality. So what are these 4 Ds of abnormality? So the first D is called as deviance. Another D is distress, dysfunction, danger. So what is this deviance? If we have to call the behavior as abnormal, these 4 will have to be observed in that particular child or a person. So here deviance means moving away from what is expected. Thoughts, emotions, or behaviors that deviate from what is common or at odds with what is deemed accepted in the society, right? So if a child or if a person has depression or any form of disorder, their thought process or the way they think, probably they may think that I am not fit for anything, right? I'm a useless child, I am very bad child for my mother. So these kind of negative thoughts will start appearing in the deviance part. And distress, talking about distress, as I told you, stress is of two types. One is eustress and another one is distress. Eustress means, say for example, you have an exam, okay, you have to prepare for it and you're feeling little stress. So because of that stress and anxiety, you are preparing well. So any form of stress which will actually help you to perform better is called as eustress. Whereas distress means it's a kind of stress which is taking a lot of energy from you and it is affecting you in a negative way. So negative feelings felt within a person and it's a result of discomfort within you is called as distress. So in the case of depression, you might report extreme feelings of distress over sadness or guilt. The third D is dysfunction. So what is this dysfunction? Inability to achieve daily functions. Say the child is going to school every day, he or she wakes up at 6 a.m. and then they do their daily routine, they eat their breakfast, they go to school, and then they concentrate in the school, they know what is their homework, and then they come back, sit, do their homework and go to play. This is the normal routine. But then because of all these things, because of the disorder, there is some dysfunction, that is inability to achieve daily functions like going to work. In the case of depression, you might have you would have noticed that children will stop going to school, they may not be coming outside the room also, they are very scared, right? So the normal day-to-day task will be hampered, they are not functioning properly. And the last one is called as the danger. It's the 4D. The fourth D is called as the danger. So here behavior that might put you or someone else at some type of detrimental risk, right? So it's called as the danger, when you are not performing really well and you are putting yourself into a dangerous situation, that is cutting yourself or committing suicide, right? So banging the head, slapping oneself. So all these are the behaviors which comes under the dangerous part. So when these 4Ds or any one or most of them are involved, then we call that the child is abnormal or there is some problem in the child which needs to be addressed. Now moving on with the next one. So here we'll discuss about the causes of the behavior. I mean the abnormality, that is the abnormal behavior. What could be the cause for a child to get such disorders or the disabilities? So the first one is called as the biological. So anything which is related to the body, that is the bodily functions. It could be related to the neurotransmitter which is in the brain. See, inside the brain there are a lot of neuronal connections that are happening. If you touch a hot stuff, you will remove your hand immediately, right? So who is telling you to do that? It is the brain which is helping you to behave in that way. It's a reflex action. Brain and spinal cord both are involved for decision making process, thinking and all of that, all the cognition part. So whenever there is a problem in the child, first of all there could be problem in the brain structure or the neurotransmitters are nothing but the chemicals. Sometimes even you would have observed, you will feel very happy and sometimes you will feel that you're very sad, right? All these things are because of the changes in the neurotransmitters that are being released in the brain. So that is another reason. And sometimes what happens is, one of the causes for mental retardation is when the mother is delivering the baby, that is during the perinatal phase, if the forceps are used to pull the head of the baby, then at that time also there can be a chances that the child becomes mentally retarded. So any problem that a mother goes through when she is bearing the child or when she is delivering the child or when the child is born, correct? Imagine that the child is born and after a few days the child falls down from the bed and its head is injured. At that time also the disorders may appear. So it's called as the prenatal, that is when the baby is in the mother's womb. Say when the mother is not taking care of the baby properly, there is some deficiency, right? Or when the mother is alcoholic, or when she is smoking, or when she takes some tablets without consultation, all these things can affect the baby. So this could be the causal factor. Biologically, prenatal, perinatal is during the delivery. Say sometimes what happens, there can be little problematic in the oxygen level that the child goes through, right? So at that time also there can be some disability. Prenatal, perinatal, and then postnatal, after the child is born, if there is some injury to the head, then it will cause some pathology. So biological, even the genes also plays a very important role. Say there is a family history of schizophrenia or depression, then the genes would have been passed on from the mother or the father or the family to the child. So the tendency for the child, see, it's not necessary that okay, mother had depression, the child will surely have depression. No, that's a wrong notion. The tendency for the child to become depressed is more, they might be little more vulnerable to the disorder, that's all. And that's where the family history comes into picture. And lack of support, imagine that the child has no financial support, no support for eating, no education, nothing, then it will create a lot of stress in the child, and they may finally die also because of lack of nutrition, right? And lack of support from the family, no parents, all these things can have, say, abuse, okay, physically the child, or the mentally someone is torturing the child, right? So this can have a greater impact when they are growing, right? So that is where the abuse part comes into picture. Accidents, when the child meets with an accident and there is part of the brain which is damaged, or the part of the body which is damaged, and that is causing a lot of stress to the child, that time also there is a disability. And family members with mental illness, that is family history and family members with mental illness, both are the same point. And substance abuse phase is the phase where substance abuse is very much common, so that can also hamper the brain activity there. It is also important to realize that mental health can change over time. Say the child would have been a victim of say sexual abuse, and he or she is completely depressed, or they have anxiety. It's not necessary that the child will remain like that throughout their life. With proper care, with proper support, with proper treatment, they can change over a period of time, right? And the CDC is Centers for Disease Control and Prevention. So they suggest that 50% of all people will be diagnosed with mental illness at some point in their life. So what does it tells us? It says that it's completely normal to have a mental disorder, but then we need to take care of our mental health by properly going or consulting a right profession at a right. And these are the common disorders which we see when it comes to the pathology part. Anxiety disorders, the child might be scared. It could be socially speaking, right? The child cannot speak in front of huge audience or in front of their classmates, or they may fear dog phobia and all of that. So that is where anxiety disorders, sometimes when the child is too anxious, you may see them stuttering or stammering, right? They may not be able to communicate properly. And then bipolar disorder is a mood disorder. Sometimes they'll be depressed, and sometimes there is mania. Depressive disorders, only depression. And disruptive impulse control and conduct disorder, you would have seen many adolescents say throwing stone, hitting the bus, or recklessly driving, right? Not listening to their parents, moving away from the house, and then killing someone, or involving in various criminal activities. So all these are the conduct disorders. And too much aggressive, right? Killing someone, all these are the disorders. Killing someone is not a disorder, but then killing someone because of a disorder, that can also happen. And dissociative disorders, eating disorders, there is something called as anorexia nervosa and bulimia nervosa, right? Neurocognitive disorders, neurodevelopmental disorders like autism, OCD, and then comes the OCD, a part of anxiety disorder. Personality disorder, see why personality disorder is included here, because childhood can be, the experiences during the childhood can be one of the reasons for the person to develop personality disorder, and then schizophrenia also. And there can be sleep problems, sleep disorders, somatic symptoms or somatic symptom disorders, substance related disorders, and trauma and stress related disorders. All these are the, this can be childhood disorders as well. Post-traumatic stress disorder, when the child undergoes a trauma, say a natural disaster, and the child loses his parents. So now you would have seen that there is a war situation happening, right? So at that time, when the child gets exposed to all such disasters, at that time they can develop PTSD also. So these are some of the common disorders, and stress is the main factor for anyone for that matter to develop any kind of diseases or disorders, right? So in the childhood, separation anxiety is very common. Say when the child is being separated from their parents, okay, there is no love from the parents. At that time, separation anxiety comes into picture. The child may fear that I will lose my parents, I will lose my parents' love, right? So that may create a lot of stress in them. Social pressure, like expectation, lot of expectation from the child. You'll have to be good at academics also, you'll have to be good at sports, you have to be good at music, right? So all these expectations from adults may also create stress in them. You have to get 95% only, right? So these kind of stress, academic pressure, as I told you, and then abuse in the form of physically abusing means simply hitting the child very badly till they bleed, right? Not tolerated by the child. And mentally also abusing them. You are fit for nothing, why did you even come to this earth, right? So these kind of words, abusive words, or sexually abusing them, right? So these can create a lot of stress in the child. See, childhood means it has to be beautiful, it has to be filled with love from the parents, elders, right? And it has to be very joyful. They'll have to play nicely, and they'll have to study, and they have to grow up. But if these things happen, then it will obviously affect the development of the child. Natural disasters, when the child loses everyone in the family, or whenever there is the separation, or whenever there is a lot of things happening with the child. Family conflicts also, when the child is witnessing, say the father is alcoholic and the mother is the only breadwinner of the family. The father comes and hits the mother every day, and there is a lot of conflict happening, marital conflict. So at that time also it may hamper the development of the child. And because of the stress, it will change the immune system of the body. Immune system of the body will be compromised, and it will influence the development of the child. So what kind of influences? There is direct connection between trauma and psychopathology. And 94% of the patients with schizophrenia reported a childhood trauma. Schizophrenia means it is a psychotic disorder. The person will experience hallucinations, delusions, right? So we'll be understanding about that little later. But I just understand that childhood trauma, when the child experiences a lot of stress in their childhood, then they may develop mental disorders, severe mental disorders in the later part of their life. This disrupted maternal infant attachment, when the mother is not taking care of the child properly, increased stress reactivity will be there, and there is release of cortisol. Cortisol is called as the stress hormone. So that will impact the child. There will be dissociative symptoms and exposure to multiple trauma rather than single trauma. Say just one trauma and done, will have a complete different. Whereas when the child is getting exposed to the trauma again and again multiple times, then the tendency for that child to develop psychosis later in the life is high. And there is something called as temperament. Temperament means, is the child very easy to handle, or Is the child very difficult? What is their activity level? Is the child very sober, or are they completely active? You have seen all these things in children, right? So some children are very active, some children they want some push, and they want to whenever they have to do some activity, they are very sober, kind of lazy kind of things, right? Biological rhythms, sensitivity. Some children, whatever you tell them, they are very strong, but some children are very sensitive, they'll start crying also. And the way they react to what you tell, how good are they in adaptation, right? Some children, they want to be with their parents all the time, but some children, they are okay to go to their uncle aunt house or their friend's house and stay there, right? So are they approachable, or do they just withdraw from the friends? And persistence, distractibility, do they continue their task continuously? Given a task, will they do it, or will they just leave? So all these things will decide the temperament. And there are, this person, Rohat, is a researcher, and his colleagues came up with 3 kinds of temperament. One is called as negative affectivity, another one is called as extroversion or surgency, and another one is effortful control. So what is this negative affectivity temperament? So here, when the child responds more readily with fear, say you tell them something, they get scared very easily, they become very sad very easily, and they show a lot of negative behavior, right, or negative feelings, then it is called as negative affectivity. Affect in psychology means emotions. When the child is showing a lot of negative emotions, then that is called as negative affectivity, which is one of the temperament. Another one is extroversion or surgency. They are inclined to express laughter, they are like happy child, right? They are very good, they are very active and impulsive sometimes, and they are approachable. And effortful control means they are able to control or regulate their behavior. They know what to tell, when to tell, how much they need to express their emotions and all of that. So they are like, they have high EQ, emotional quotient. They're very good at controlling. Self-regulatory behavior is very good in them, right? So these are the 3 domains under temperament. And coming to the last part of the general treatment which will be given, so medicines will be the last mode of treatment for any form of disorder. Most of the time psychologists will try to manage with the therapies, but if the symptoms are going beyond the control, then medicines will be preferred, right? So ADHD, or when the child has schizophrenia, depression, suicidal thoughts, at that time psychiatrist help is very much required. Otherwise, behavioral therapy, when the child is not sitting and doing his homework, we use positive reinforcement, sometimes negative reinforcement, sometimes punishment also. So based on that, behavioral therapy will be used. Applied behavioral analysis is used very much in autism, treating autism. And nowadays art therapy is flourishing, right? Because children will be very good and they are interested in art. So art therapy is another form of treatment. So storytelling can also be therapeutic, right? We can ask the child to tell story about himself or herself and get to know what is happening in child's life, ask them to draw and all that. Yoga and meditation are the other forms of alternative treatments. It's not the treatment, but then it is the alternative treatment along with the main treatment. So other disorders and all, we can understand about it in the next upcoming classes. Thank you so much for your patient hearing.